Hello, everyone. Sylvia here from Rock the Cradle. How is everyone today? I am doing well. Yes, yes, yes. It's Friday, Friday. Exciting discussions today. But before we get to that, I just did want to mention some in-house stuff. We are offering French prenatal classes. We have a session at the end of March and one in June. We've got an intensive summer session coming on July and August, 4 evenings over 2 weeks each month for those who want a more intensive session rather than 2 full days, and who wants to be cooped up in class when we only have a few summer weekends, right? Hello, Mika. Hello, Mirsa. Mirsa's from Ottawa. Lovely, great topic today. We're talking maternal mental health, and I have a lovely guest. And the challenge today is going to see if we can get her on, because we tried last night and I couldn't. So I'm going to try. Be patient with me here. Great topic, and I can't wait to delve right in. I don't see you, Simcha, on this. Important. I remember having no, Simcha, I don't see you. I don't know if you can hear me. I don't know. Can you? How are you, Mersa? Yeah, I'd love to if you're watching. We've got a few watching. Type in your name so I can see who's on. And the more people that comment, the more people that will be watching at the same time. So Simcha says she hears me. She's logged in as Lisa. And let's see. I don't know. Can you guys all see me? Here we go. Sorry about this. I even have my husband here. Can I add JP? I'm going to add JP on. Go get JP. JP's phone. I'm adding him on. Jennifer, you're back. Jennifer and I had a lovely talk chatting yesterday at 11 p.m. trying to get Dr. Samuel on the line. She was busy. What do you know? What was she doing? She was breastfeeding. Jennifer O'Neill. My gosh, I have people from my past life. For those of you who know me. Oh my
Hello.
gosh. Oh my
It's a
gosh.
miracle.
It's a miracle. It's
Hello.
her. Thank you, JP, for all of you
Yes.
who may have seen JP last night at 11 o'clock trying to get us here. It's
Technical
working.
support. Yes.
Technical support. We're going to talk about it takes a village. Hey, sweetie. It takes a village in life. My gosh, I need a life doula.
Mm-hmm.
I need a life doula, not just a mommy doula. A birth doula. I need a life doula. So welcome
Yes.
everybody. Welcome. It's so nice
Yes.
to see you, Simcha.
Thank you
Finally
too.
online. As many of you know, we've been using the space at Connect Psychology, which is a
Mm-hmm.
place here locally
Yes.
in Montreal. And Simcha is one of the doctors there, a psychologist who works with families and who works specifically with new moms.
Mm-hmm.
I believe that's what you do. That's why you're
Yes.
here.
I do individual therapy with people and a lot of pregnant moms and postpartum moms I'm starting to see more of.
Nice. Yes. Well,
Mm-hmm.
not nice that they need the help, but nice that we have resources to send them to.
That's right.
Today, what we're going to be, this is a topic we could have a whole symposium. There are symposiums on this full day weekends. We have maybe half an hour. So
Mm-hmm.
we are going to, cover what are the challenges new moms are facing. I'd love to know why new moms, no details, but why new moms are coming to see you, what the
Mm-hmm.
challenges they are facing. I will share my
Right.
story. I'm an open book as usual.
Right.
And why, what can we do for them? And we'll finish up with some resources. And then our half hour will fly by. Will fly by.
Perfect.
So welcome. So I'd love to know what, no, I'm going to tell you my story first. Oh, about me.
Good. I'd love
Um,
that.
I gave birth about 11 years ago now, and
Okay.
I found it very, very difficult. I was a career person working 60-hour weeks. I had been for
Mm-hmm.
many years. Wanted to get pregnant, had my baby, and then all of a sudden I was home alone
Mm-hmm.
with this little human who doesn't, who demanded every moment of my
Everything.
time. Such a high needs baby. He wasn't a sleeper ever.
Mm-hmm.
At the end of the year, I I think I realized I had postpartum depression, but I only realize it now that I'm working with new women. At the time, I
Mm-hmm.
just thought I'll judge through this, get through this, and this is normal. And I realized,
Yeah.
no, it wasn't that normal. But
Mm.
so many of women we know, when we start
Mm-hmm.
sharing our stories, are going through this. So
Right.
what are, for me being like sleep deprivation was a challenge,
Yes.
and the identity crisis from going to
Yes.
career woman. Do you see that in
I
your
see that a
practice?
lot. Actually, I was thinking about some of these issues in preparation for talking to you today.
Yeah.
And it's so funny because literally on the side of my screen, I'm like, things that come up, challenges that come up for new moms that they are facing. And I literally have sleep deprivation, social
Yeah.
isolation, identity crisis,
Right.
the same things that you're mentioning.
Yeah, I think I live them. I live them all. If it hadn't been for a friend I made in cardio stroller
Mm-hmm.
class who just kept knocking on my door, and she'd
Yes.
say, "Let's go for a walk," and I'm like, "Oh, but I have so many things to do, and I'm tired," and I would just go. It made me feel so much
Mm-hmm.
better. Had I not had her, I think it would have been worse. But
Exactly.
so social isolation is one. Uh,
Yeah.
yeah,
Well, I think everybody can relate to a time in their life where they were really sleep deprived, whether it was in school or for work, but having that chronic sleep deprivation for weeks and weeks and months really, really takes a toll on people's mental health. I mean, concentration, sort of fogginess in the
yeah.
mind, a lot of irritability for
Hmm.
people, um, which I think happens to men too. You know, it's not just a perinatal
Yeah.
thing. When we don't sleep, we're more irritable. It just makes sense. So
I
there's a
would
lot of
love,
that.
I would love for everyone who's watching. Hey, Rebecca, nice to see you. Please share what issues you went
Mm-hmm.
through or what you experienced and what you may be experiencing now. I would love,
Mm-hmm.
please share. This is a space. The more we talk about it, the more we realize that we're all living some form of this. Maybe my neighbor whose baby sleeps more, but she might be having that isolation crisis, being by herself. Who doesn't have
Right.
parents here, doesn't have family, doesn't know
Exactly.
where to go out and make friends. What about? Do you see any women? Me, I get a little triggered with those perfect moms on Instagram.
Well, this is, I think, part of the issue is that people are looking at images of their peers on social media and they're seeing this image of what looks like the most well rested, happy, calm, organized mom who just has everything together. And we
Yeah,
look at that and we mistakenly think that it is representative of their everyday life. And
right.
we, of course, after comparing ourselves, feel like we're completely inadequate and we feel like what's wrong with us because our house doesn't look that clean. We're not wearing that makeup. We're wearing a
Yeah,
bathrobe. We're covered in spit up and anyways, moms know.
yeah.
Um, and so we feel like we're inadequate. We feel like we're failing and we wonder what's wrong with us. And there's a lot of shame that comes with that. And it's really unfortunate. So I think that if people do use social media as a way to connect with people and derive those benefits, then that's great. But I think it's so important to keep in mind that what you're seeing in these images is not always representative of what people's lives look like
Mm-hmm.
95% of the time.
Right.
So,
Yeah, it's so important. So important.
mm-hmm.
I laugh, and then I posted a picture of my girls recently. We were in Panama over the holidays, and it's a gorgeous picture. And people say, "Oh, what gorgeous girls you have." And I said, "Yeah." And in the post I wrote, "Don't be fooled. Like, to
That's
get this
it.
one picture that my husband took, it took 15 to 20 minutes of them screaming and
That's it.
yelling and sticking their tongues out. And then as soon as we said 3, 2, 1,
Mm-hmm.
they pose and we have that perfect picture, but
And
it
it's
really
amazing
wasn't like that at
because
all.
even kids know what to do. Even kids realize that, like, okay, now I'm supposed to act perfect and look super happy and put
Right.
together. Um, so I think that's really had an impact on people, especially new moms, because they have more time at home. So they're probably going on social media even more. And so
Right.
they're more, those images are more salient in their minds. I
Right.
find also that I see a lot of moms who are highly intelligent and moms who had a career or a job
Mm.
before they got pregnant and gave birth, and so their minds are used to a certain level of intellectual
Yes.
stimulation and they're used to a certain level of mental activity, and then
Oh
they
yeah.
find that all of a sudden they're home, their partner goes off to work, their friends are all at work, they're home alone with this, you know, this person that
Adorable baby,
they
however.
love. However, this person's not exactly intellectually stimulating just
Yeah.
yet. You know, when they're really young, sometimes they can't even smile at you or coo at you yet. So you're really having to give everything to somebody who can give you back very little feedback. And so
Yeah.
I find for a lot of moms, their minds almost don't have something, there's no meat for them to cling to in
Yeah.
terms of like
Oh,
material for them to
I,
think about.
yeah.
And so things that normally would have been quite trivial for them, their minds will just spin on it.
They become focused. We become focused on that. Yeah, and
Yes.
Marissa says, I think caring for young children is physically exhausting and the accumulation of lack of sleep. And then I can't see the
Yeah,
rest of her message, but yes, it is
totally.
physically exhausting. When I went back to work, I was like, oh my gosh, this is so great. I can, you know, go to
That's
the
it.
bathroom when I want to. I can go shopping at lunch. I can go see a friend. I can talk
Totally.
on the phone. It was such a break to go back to work. And I was
Mm-hmm.
happy to go back when I was on another mat leave. Now, you mentioned a great point, and it's that pressure to be perfect. Now, do you find that
Mm.
comes from internal sources, like our own selves? Are we putting this pressure? I know that I work with families who the pressure sometimes comes from mothers, their
That's it.
grandmothers.
Yes.
So I think we're
It
faced with both this pressure
it
to
sort of
be
comes in
better.
at every level. I've seen women who have, even before they became moms, a general tendency to be a bit perfectionistic and quite
Mm,
self-critical. And so we really see that getting amplified when they become moms, because of
mm-hmm.
course we're told our whole lives that this is one of the most important roles we'll ever play. And so it's like all of those pre-existing tendencies really come out with this sort of situation.
Yeah.
And then, as you said, there's social media, so that's also playing a role. And then there's the messages from people in our lives, whether it's our parents, other family members, other friends, people who have gone through it and are
Yeah.
often well-meaning and think that they're giving you advice
Good
that they would have
advice.
liked to have. And sometimes it is. And I think people have good intentions, but the implicit message is, you don't know this and you're not doing this, and that's why I'm telling you this.
Yeah.
And so moms who are already feeling inadequate and exhausted are taking that in. And I remember being on mat leave myself, and one of the most, I want to say, like therapeutic things anybody ever said to me was not a piece of advice. It was, you're doing a good job. It's so
Yes.
simple, but that I was just like, okay, I'm doing a good job.
Right.
It sounds so simple, but I think
Yeah.
that was more helpful than any specific advice about diapers or
Or
nap times or.
yeah, and it's always sleep, right? We everyone I
Mhm.
think can probably, do you have a good baby? Does your baby sleep? And I'm like, I'll be the first one to say that doesn't mean we have good, like there's no such thing as a good baby. They're all good babies. They're all good
It's
babies, even if
true.
they don't sleep. Yeah, so you see a lot. How the one I don't think we've mentioned the number one thing, and I was reading an
Mm-hmm.
article this morning, and
Mm-hmm.
I have them my little posted here, and we talk a lot about right now
Mm-hmm.
self-care is all the rage. Allô Maggie, nice, c'est le fun de te voir. Um, Talking about self-care, but I
Mm-hmm.
talking about self-care and go get your nails done, go get your hair done, go get a massage. While all of that is very nice, I
Yeah.
don't think that's the right message to be giving the new moms. I
Mm-hmm.
think it's really more of the, like you said, the emotional support and the
Mm-hmm.
physical support of let me take your baby for half a
Mm-hmm.
day where you
Yeah.
go with your spouse or go by yourself or a full day.
That can be huge,
Yeah.
just to have a break. It could even be something as small as 30 minutes. Just have your partner take the baby for 30 minutes so you can go and take a shower. It sounds so basic, but just you
Hmm.
feel a bit more like a human again. Do you know
Yeah.
what I mean?
Yeah.
So I think things like that. But yes, I think like the basic things are pretty important, like go outside, take a walk if you can, just put on your clothes instead of like, I think we just, it
Yeah.
takes a toll on our mental health when we're just in our bathrobes for 3 days in a row. I think
Right.
that, but the thing is, it's like a catch-22, because what I see, whether it's postpartum or not, is that when people feel kind of down and depressed and their
Mm-hmm.
energy and their motivation is just not there, and somebody says to them, well, just go take a walk,
Yeah.
it's so aggravating for them because they're
Right.
like, A, that's not going to address my whole problem. And B,
Right.
do you understand how little energy I have to do
Right.
these things?
Yeah.
And so
Yeah.
it's not only not always helpful for them to hear that, it's sometimes very frustrating for them to hear that.
Yeah. Yeah. Like I heard like, oh,
Yeah.
go buy a new lipstick. And I was like, well, I don't think that's addressing the issue of not having support, right? And I think
Right.
that we talk about birth as a village.
Mm-hmm.
However, I find many people don't have a
That's
village
it.
anymore.
Yeah.
We don't live in these communities as perhaps our,
Right.
ancestors did. And I
Mm-hmm.
really feel, and when we talk about isolation, that
Mm-hmm.
being a real part of it. We work in our doula practice
Yeah.
with lots of families who are from elsewhere and don't
Mm-hmm.
have parents. I'm lucky.
Yes.
My parents are around. And I still went through issues, and my parents were involved, and I still
Mm.
was, sleep deprived and
Right.
felt touched out and all of
So you
it.
can only imagine.
So I can only imagine if you don't have that support. So,
Right.
we're going to talk resources. So for sure, postpartum doula services can come
Mm-hmm.
in to play.
Yes.
But I think as a society, we need to deepen our reflection. It's not just about, yes, it is getting out of the house, but it's also addressing that lack of support for families.
Support is huge, and I think it sounds really trivial to say go take a walk, go take a shower, but I think the message is not, it's not about the lipstick, it's not about the walk, it's about
No.
starting to feel normal again
Mm,
and starting to feel less sort of isolated and boxed in your house and feeling like this is just, you're going to be your life forever. It's like going outside and starting to do some of the things that make you feel sort of less isolated, less trapped, less down.
mm-hmm.
So what I meant before about like people, even when they're depressed or their mood is low, that's the thing they want to do the least. They don't have the energy and
You're
the
right.
motivation to, go do an activity or take a shower or do these things. But sometimes paradoxically, that's the most important time to do those
Right.
things.
So you do
So
suggest all of that as well. It's like
as well,
it's
it's both.
small steps.
Yeah. And it's, I sort of view those things as necessary, but not sufficient.
Right. Right.
Right. So it's really important for you to feel like a person that deserves to take a shower and deserves to wear their clothes and to go outside. And, if you're
Mm-hmm.
somebody who was really into your career before, then maybe you just take 5 minutes and read like the
A biz
latest, I don't
book.
know,
A business
something
book.
remotely related to that topic, just so you
Yeah.
connect with that part of yourself. But it's not about the concrete walk. It's about feeling connected to your old identity a little bit and feeling normal and like you're a whole human and you're
Yeah, and
not
think
only.
yes. Yeah. That's lovely. So I think that's what you've touched upon is that we're not getting that second part of those sentences. We're just go get your hair
Mm-hmm.
done, but it's no, go do something that can connect you to your former self as a
Exactly.
person. Who were you
Exactly.
before you had children? We've just added a new layer to
Well, that's
ourselves.
it.
We're
I think
not forgetting
especially,
who we are.
no, and I think
But we do.
especially,
We do. We're martyrs. We
yeah.
become like selfless, right?
And that makes us good moms to
Yeah.
erase ourselves and to only focus on our kids. And
Right, right.
I think that we get that message a lot, but I really try to work with my clients on recognizing that you can't pour from an empty cup. And if you're
Yeah.
depleted and
Yeah.
you're just completely negating your own needs, you don't have the energy and, you don't have the energy really to give to your child. You're not fully there to give to your child. And how could you be? Right? So
Yeah.
by filling yourself up, you're actually more present for your child and you're actually
And your
really,
spouse and your mother and your friend.
and not only that, but we're modeling really
Yourself.
good behaviors for our kids
Yeah.
when we take care of ourselves,
Yeah.
especially for girls, right? Because we're told so much, like just care for others. It's all about others. And so by
Mm-hmm. Mm-hmm.
modeling for our kids, we also take care of ourselves. You're teaching a really important message to your kid, and it starts really
Yeah.
young. Yeah.
Does this resonate with anybody who's watching? Please let me know. Please let us know.
Yeah.
I know it does because we get the calls and in our mummy
Mm-hmm.
groups, we have mummy groups and
Mm-hmm.
sometimes people don't share and then I've had some groups over many weeks that they do share
Mm-hmm.
all of the frustrations. because not
Yeah.
filling up your cup doesn't allow you to be a good spouse. Not a good spouse, but not, I'm not saying always, meeting the needs of your
No.
spouse, but you want to be a good spouse. That's the person you loved and had children with.
Yeah.
Yeah, and I mean that's happened to us after every single baby. And I find it's this, we call it the emotional roller coaster, right?
Hmm.
Um,
And a
I
lot of
don't.
moms, they think of postpartum depression or anxiety as like being nervous or crying, and they
Mm,
miss the cue of irritability. And that's really huge for a lot of moms. They're like, well, I'm not crying. I don't think I'm depressed. A lot of moms doesn't come out so much as sadness. It gets expressed as irritability, especially with their partner. Sometimes you'll see a huge increase in arguing and things like that. Doesn't
yes.
necessarily mean that they're depressed, but sometimes that can be a sign that
Yeah,
mood
what
is lower.
move into that, Simcha. What I we talk about signs of not
Mm-hmm.
getting out of the house,
Mm-hmm.
for several days, not
Yeah.
calling your friends, not going to mummy
Yes.
group, not reaching out. What are the
Staying
other signs? Like
home.
not
Yeah, staying
showering.
home, ignoring calls,
Mhm.
feeling excessively guilty. I notice is a
Right.
big one for moms. I think there's a certain amount of like almost cultural mom guilt. But
Yes.
it
Yeah.
for some people it's really, really um, very salient, very prominent.
Right.
Um, let's see what else. For some moms, I mean, I think for every mom we get home from the hospital with this tiny human that is completely helpless and is entirely
Yes.
dependent on us to take care of literally their every need aside from breathing, and we feel completely overwhelmed by that and
Yeah.
ill-equipped for that responsibility. And for some moms, as they go through the motions, they start to feel more okay. I can do this, and they have support. But for other moms, that feeling of being ill-equipped really
Mhm.
stays there, and they feel completely panicked.
Mm.
And there's a feeling of really intense anxiety that really permeates most of the day, almost every single day, and that's a different
Wow.
degree. So for a
Yes.
lot of what we're talking about, um, the feelings are normal for many, many moms, but it's about frequency. It's about intensity. Is this the dominant thing that you're feeling? Is this taking over, so much of your thoughts? Is this at the forefront almost every day for you?
Right.
That's
Then
that's
that's
more
a
concerning.
problem. That's an
Yes.
issue to get
And then
addressed.
to go more, to go to another topic is that if you're having thoughts of hurting yourself or having thoughts of harming your
Mm-hmm.
baby, that's obviously more urgent and that's more something that needs to be seen right away. For example, in an emergency room, if you really feel like you're going to harm yourself or your baby,
Of
that's really more
course,
urgent.
yes. Yes.
But for a lot of moms, they don't know where to draw that line between, well, is this just normal kind of baby
Mm-hmm.
blues that a lot of people get, or is this a depression where I actually need to seek help? And I don't know. I like the approach of erring on the side of caution. If you're not sure, it's better to go consult. It's better to go
Yes,
ask.
yeah. It's one
You
like I
know?
say, just go see just once, right? Jennifer says here, yeah, we always think the postpartum signs are the harming oneself, harming a baby, but
Mm-hmm.
and having gone through it and realizing, yeah, I probably had some kind of degree.
Mm-hmm.
I like that you mentioned, especially the irritability. I was probably really irritable. My husband's
Of
right next to
course.
you. He's probably nodding his head. Um, and yeah, that irritability and the tiredness, the not being able to sometimes get through a day. Yeah. And,
Feeling really hopeless.
and not happy, right?
Yes, and again, it's a matter of degree, right? Because
Right.
a
Yeah.
lot of moms at first we're doing the same monotonous things over and over, day in, day out, with very little feedback and very little
Yeah.
interaction. It's
That's not
normal.
fun to begin with. Yeah.
It's normal to have moments where you're like,
Yeah.
I'm I'm not feeling this right now,
Yeah.
but it's different if that's the dominant emotion for you most of the
Right.
day,
I
so
think
many
that's
days of the
key,
week.
right? That's key. It's
It's
if it's the
severity.
dominant emotion taking over.
Mm-hmm.
And yes, go and just talk to somebody. Because we can't always talk to our friends or our moms or our mother-in-laws, or if we'd want to talk to them, but or colleagues. We don't want to
Yeah.
necessarily show our vulnerabilities. We're strong
Yeah.
women, right? We're taught that. I teach my girls to be strong, but there's also it's okay to
That's
cry.
it. That's
Yeah, and
it.
Marissa says yes, anxiety was taking over. Lots of more prenatal anxiety I find in our
Yes.
clientele.
Yeah,
Is
I
that
mean,
a
if you think about
precursor to postpartum anxiety? Is that all
so
related?
moms with a history of mental health problems before getting pregnant and moms who've experienced something during pregnancy can be considered more at risk. So
Mm-hmm.
should be, monitored and noticing what's going on for them emotionally more carefully. Um, but certainly I think society talks a lot about um, perinatal depression and the blues. We don't talk as much about anxiety, but
Mm.
it's huge. And if you think about what anxiety is,
What
anxiety
is
is
it?
all
What
about
is it?
anxiety is all about the future.
Ah,
Anxiety is all
okay.
about, like, sadness is usually about things in the past. Anger is usually about something that's present, and anxiety is usually about something in the future.
Oh, I
And
love
so,
that.
if you
I
think
love that.
about it's something we're not sure, something bad may or may not happen in the future.
Mm.
So if you think about you're pregnant, something is going to happen in the future. You're going to
Yes.
give birth. And especially if you're a first time mom, you don't know how this is going to go. Is that not a recipe for anxiety?
Yes.
Some
Oh my
I,
gosh. Yes.
uncertain thing that may
Yes.
go wrong in the future. That's what anxiety is, and it's feeling ill-equipped to handle the demands of the situation.
Yes.
So,
Yes.
yes, of course there's anxiety that's going to come
Yes.
up. And again, it's what's the degree?
Right. Right. Is it taking over your life? Hi, Maya. Maya is a new mom. We can all congratulate Maya.
Oh,
Just had a
congrats.
little baby. So exciting. She's probably going through all of this stuff. Yeah. Or maybe she's not off that birth high just yet.
That's a
Yeah.
really important point because for a lot of people, the first 2 months they're sort of on adrenaline.
Yeah.
They're just, you know,
Yeah.
they're all instinct. They're just going, and they don't recognize that sometimes around 2 months they hit a crash where the adrenaline's starting to fade, and now they're feeling more depleted. Now they're noticing more irritability. So
Right. Yeah. Oh, that's
something
good.
to look out for. Yeah.
Yeah. So what, I mean, resources, of course.
So, for
We,
example, talking to your
yeah.
OBGYN, talking to your doula, just saying, this is how I feel. Is this something that I should get checked out? Is this something that I should get treated? Just ask the question, start the
Mm-hmm.
conversation about it. And realizing that these are people who are working with the perinatal population. So you're probably not going to be the first person or the last person that raises this issue with them.
Right.
This
Right.
is what they're dealing with a lot of the
Mm.
time. And so I think for some people, recognizing that can be quite destigmatizing and they feel
Yeah.
more able to bring it up.
I wish and on another show we did talk about that in postpartum, but I
Mm-hmm,
find the obstetricians at your 6 week appointment don't necessarily delve into any of this, or not too
mm-hmm,
much anyway. There are
mm-hmm,
some good ones that do,
mm-hmm.
but they're
Yeah,
quite just, focused on not even feeding. I was going to say feeding, but not even feeding. It's really about your next birth control. I mean, what birth control are you going to take? That's
that's
what
a
I
major
found anyway.
topic.
It's a
That's a
major
major
topic. What are you
topic
going
for
to take?
people.
And I'm like, or, and making sure your cervix is back in place. But
Mm-hmm.
not one of my doctors said to me, so how are you really, Sylvia, doing?
Mm,
How are you doing? None of them.
that's it.
None of them.
And it
And
would
you
be
leave that
great.
office feeling like, why did I even go? Like,
And
why did I even go?
if you're the kind of mom who sort of minimizes their emotions to themselves,
Mm-hmm.
doesn't recognize them in themselves, or just doesn't want to get in people's ways, doesn't want to burden other
Mm-hmm.
people, which is also
Yeah.
huge with depression. We feel always like we're a
Right.
burden to others.
Okay. Okay.
So if that's the kind of profile you have, then when a doctor either doesn't ask it or asks it very quickly, you might feel like really reluctant to actually initiate a more prolonged conversation about it. But it's incredibly important because
Yeah.
um, for many people, this is not something that just goes away on its own.
Right. Right.
It really requires attention.
So vocalizing how we feel,
Mm-hmm.
vocalizing how we feel. Yeah. I mean,
Exactly.
sometimes we're going to be like, how do you say that? Redundant. We're going to feel like we're saying the same thing over and over. But you know what? I'm tired. I'm tired. I'm tired. It's life at that moment in time. Other resources. Yes, I would say, in our group for sure, postpartum doulas. Even if you don't have a postpartum
Mm-hmm.
doula, call your birth doula up.
Mm-hmm.
Uh, we've got
Yep.
lots of resources, and your doula will have lots of resources. We work
Mm-hmm.
with people like Simcha and other consultants and other therapists.
Mm-hmm.
There are resources out there. You had mentioned OBGYNs and family doctors. I think even your CLSC nurse is a
There's your CLSC
good,
nurse.
yeah.
The CLSC nurse tends to even go to people's houses soon after they've given
Yes.
birth, so they
Yeah.
probably get this question quite a bit. You can also ask other moms who have been through this before, who they saw,
Yeah.
and I find that it can be really helpful if you're seeking, for example, a psychiatrist or a psychologist, to talk to people who have some kind of background with this time period, because there are some things about it that are quite specific. So I think it's always nice to ask the therapist or to ask the psychiatrist, do you work with this population?
Right. Yes. It's the same thing, I think, with almost every caregiver. If you're going to see an acupuncturist and you're pregnant, you want to make sure they have, experience doing but you definitely experience in the postpartum, because then you want to get the right care. You really want them to understand. Talking with other moms. I'm on a few very, very big groups here in Montreal, Facebook groups. Perfect Moms is one. I think many of you are on that. Bad Moms group is another one. And you see these anonymous posts like, I'm having a really hard time. And then the encouragement that comes. And sometimes that encouragement, though you don't know these people, it can be uplifting. There are also in-person groups. I know we host one in Laval every second Monday, one in Westmount every second Tuesday. They're not, they could be better attended. As everyone's watching, please come out. That's there's always a doula there. I know other doula groups have moms groups as well. And we do that so people can, have a safe space to come out and get out of the house. It's to breaking that isolation that we were talking about.
It's a 2-in-1.
Yeah.
It's a 2-in-1. It gets you out of the house. It gets you social support. And it's like some moms will actually go ahead and give each other advice, but it's sort of just to have somebody else there to say, I felt the same way, or I'm going through the same thing, because it reduces the shame, right? When moms feel that they are the only ones going through things and they feel really isolated in their experience, the shame creeps in. They're like, there's something wrong with me. I'm missing some kind of instinct. I don't know what to do. Everyone else knows what to do. And then we isolate ourselves. Like the urge when we feel ashamed is to hide, right? And so the antidote to shame is showing, not hiding, right? So going and talking to people about it. And I think, your point is well taken about having groups and talking to other moms, either online or in person. But I think it's equally important to monitor, how do you feel during those interactions and after? If you're leaving those interactions feeling worse because you're feeling judged or you're feeling criticized, that's something to reflect on. But if you find one or two people with whom every time you leave, you feel, okay, like a little bit calmer, a little more understood, or somebody gets it, then that's guiding you.
Yes.
Then maybe you need more of that.
Yes. Yeah.
Use your emotions as a guide.
Exactly. I love these points. Do you have anything? How can we reach you, Simcha? How can moms reach out to you if they need some help?
Well, I'm at the Connect Montreal Psychology Group. So it's a psychology group that's in Westmount near Atwater Metro. So you can contact the Connect Montreal Psychology Group.
I'll put the link in the comments afterwards.
Yes, for sure.
Yes, definitely.
So you can contact me through the clinic, and I can also provide other referrals to therapists who specialize in seeing women during this period.
Yeah. If it's not there are resources out there for sure. You can always, if you're having issues, call us up, call your doulas up, and we will direct you. We may not know how to help exactly, but we will provide resources. I think that's one that is so important. And to feel that, you have someone to call that's non-judgmental. Like we're just going to.
And sometimes just making that, I've heard so many moms say, like, once I just made the call, I felt some relief.
Right.
Because, okay, I'm going to see somebody, like it's going to move somewhere. They have some hope. Do you know what I mean?
Yes.
So just sometimes making that call is a really therapeutic first step for people.
That's good. I always say, you don't want to be living your maternity leave like this, right? So do ask for the help so it's enjoyable, and there are ways of, getting out there. Thank you so much.
Oh, it's my
Oh, I'm so
pleasure.
happy that this happened. This
Me
finally
too.
this happened. That we got you
I'm
online.
glad.
Thank you to our technical support team.
Yes, thank you.
Uh, Thank you everyone for listening. Thank you everyone for sharing. And yes,
Yes.
motherhood is not easy, and that's why during these
Hmm.
shows that we have different people on. I just want to talk about stuff that people don't talk about all the time.
Right.
It needs to be talked about. We live in an
Hmm.
age where we can talk about anything, now. It never used to be that way in our mom's times. They
It's
couldn't
true.
talk about stuff.
Yeah.
Yeah, I always laugh. My mom probably just had a gin and tonic, at the at 4 o'clock at the time. But it's not the good way
Yeah.
to really, talk about what we're going through. But yes, thank you everyone, and we will see you soon. Thank you,
Thank you.
Simcha. All right, bye
Bye.
everyone.